Hi everyone, welcome back to Dr. Us Podcast, episode 33. In today's podcast, we're going to be discussing about medications that can increase the risk of falling. Yes, there are medications that can cause falls. We should not underestimate the danger of falling, especially among the elderly. Did you know that there are more than a third of elderly people who fall every year in Malaysia? And that's a huge number. In old people, falling can result in injuries or even death. Therefore, it should be taken seriously. So, why do elderly fall in the first place? An obvious reason is due to old age, which comes with impaired body coordination and balance. Another risk factor that gives rise to the risk of falling is actually taking medications, in particularly taking many medications at one time, and this is also known as polypharmacy. However, this factor is often overlooked. Our elderly population is the biggest user group of medications. They take all sorts of medications, from blood pressure medications to pain medications or even medications for dementia. Among these medications, there's a group of medications that's associated with significant risk of falls, and they are known as fall risk increasing drugs. Now, let us get into each type of drugs in more details. Let us start off with antihypertensives. These medications are normally used in patients with high blood pressure. The risk of falling is caused by the drop in blood pressure. Another drug class is diuretics, which are also known as water pills. They are used to get rid of excess fluid from the body, and they are commonly used in the treatment of heart failure. As fluid leaves the body, blood pressure will drop, and this may cause drowsiness and increase the risk of falling. Now, let's move on to beta blockers. I'm sure we're all familiar with these medications. They are actually a group of medications that's also part of the antihypertensives. They are also used in the treatment of heart failure, but people with anxiety of hypothyroidism do take beta blockers as well to reduce tremors or heart palpitations. Just like diuretics, beta blockers also reduce blood pressure and can cause dizziness. Another type of drug is alpha receptor blockers. They can cause a drastic drop in blood pressure known as orthostatic hypotension, and this may often lead to fall in elderly. Another class of medications that can cause our blood pressure to decrease is glyceryl trinitrate, also known as GTN. Just like the previously mentioned drugs, GTN can decrease blood pressure, which ultimately leads to the risk of falling. Medications that can cause drowsiness can also increase the risk of falling in older population. Examples of these medications are sedatives, neuroleptics, antidepressant, and benzodiazepine. These medications are commonly used in patients with mental health disorders. Drowsiness is one of the known side effects of these medications. Therefore, patients who are taking these medications are at increased risk of falling. The last classes of medications that can increase the risk of falling are medications that are used to treat pain. These medications are narcotics and non-steroidal anti-inflammatory agents, which are also known as NSAIDs. These medications can cause drowsiness, therefore increase the risk of falling. While some medications do increase the risk of falling among the elderly, falling is a multifaceted problem that requires a multidisciplinary approach. Work with a team of healthcare providers that you trust to reduce fall risk of elderly under your care. The first approach is to talk openly with the elderly and their doctor about fall risk and prevention. To do this, you can show the doctor or pharmacist all of the elderly's medications, including over-the-counter products and any supplements. If the elderly is taking any high blood pressure medication, do make sure the doctor is aware. Second, you can encourage the elderly to stay physically active. Exercise and movements such as Tai Chi can be beneficial for the elderly in preventing falls. Otherwise, you may also consult a healthcare professional on a suitable exercise for the elderly. Another approach is to get the elderly to check their eyes and feet regularly. This is very important because being able to see and walk comfortably can help to prevent falls. To do this, you are advised to have their eyes checked by an eye doctor at least once a year and replace their eyeglasses as needed. Also, have their healthcare provider to check their feet once a year. Do discuss proper footwear and ask whether seeing a foot specialist is advised. Last but not least, do make sure the home environment is safe, as most falls happen at home. To do this, ensure the home has lots of light and always keep the floors clutter-free. Another useful tip is to remove small rugs or use double-sided tape to keep the rugs from slipping. Also, add grab bars in a bathroom, as it can be very slippery at times. That's it for the risk to reduce fall risk. Do keep in mind that falling is a public health problem among the elderly, and it deserves our attention and care. That's the end for this week's episode. If you have any questions related to healthcare, you can consult our professional doctors and healthcare professional on Doc to Us. For better communication, you can even send our online doctors image or voice messages related to your medical inquiry. You can also download Doc to Us app on Apple App Store, Google Play Store, and Huawei App Gallery. Take care, and we'll talk to you in the next episode. Bye!